But healthcare reform has captured our political debate. I believe the healthcare reform debate is part of a greater agenda to transform our culture to a European socialistic model. I travel the world frequently, 8 to 10 times a year out of the country. I've worked with physicians from the European socialist model. They all can't wait to get to a private practice model along with their European socialist model. They envy what we have. They have good models, but I think we have a better model. I will say for you as patients and for me as a physician and for any of you who are other providers, like Penny Louise, who's a nurse practitioner. We may have PAs in the audience tonight. Many of you are nurses. Same is true for you. Reform will have profound implications for how you work, how you're paid, and your quality of life. And the debate of healthcare in society is really not really a scientific debate. It's more of a political debate. And it's one of those debates where ultimately you'll take a side. You'll be on one side or the other. There is nobody straddling the fence on this when all is said and done. Let's have the next slide, please, Bruce. So why are we having this debate in the United States? Well, there are a few reasons, and we'll do the next slide. One, healthcare is really too expensive. I work at a medical center in Rochester that's viewed as one of the great values in healthcare, but if you get an appendectomy, at my institution will cost you $20,000+. If you come in tonight with a laceration or a cut in the emergency room, that's $3,000. All of that seems too expensive for me, okay? You understand that you're paying for it, so am I. It's almost too expensive for any of us now, okay? Secondly, politicians, and there are a few in the room tonight, and I'm a recovering politician, not running for office, so I can say what I think tonight. Most politicians are very self-serving. They want to do what will help them win. They're kind of like people running Wall Street in some sense of the word. They're in for it for the short term, but they don't think about the long term. And so if you're a politician running for office, the number of uninsured makes a good political case to justify doing something, okay? I think Fran will show you data, and I will too, that the number of the uninsured hasn't changed a lot. Not the number of the percentage, it's just a fixed percentage of 15% of the U.S. population for many years. Thirdly, businesses need predictability for benefit cost. I used to give this talk, in fact I gave a similar talk 2.5 years ago in China, and I asked people if they were more afraid of Hillary Clinton or GM. Everybody's more afraid of Hillary from the healthcare standpoint because she tried to reform it, but the truth is GM has brought in more profound change than Hillary ever did. And they had to because it's driving them out of business, and now they're in bankruptcy in part because of healthcare costs. And finally, all of us as patients are quite angry at the restrictions insurance companies have placed upon us to try to control costs. And I think you've had that experience. I can't see a patient in Iowa where I'll be working tomorrow without having to justify why I need this imaging test, and spending time on the phone with the Blue Cross insurance company in Iowa that's an 80% monopoly of Iowa's market. So we're all frustrated with that too. Let's have the next slide. So healthcare is too expensive. This is my, next slide, Bruce. This is how I usually see it. You have a discussion with a patient, then you say to them, the second prescription is to calm you down after you see the cost of the first one, okay? And it's so true. Pharmaceutical companies today price new medications to cost $120 to $150 a month, unless they're biologic agents where they price them in the thousands of dollars a month. That's just too expensive. Let's do the next slide. This is one of those economic slides, all right? This is what scares economists. They say that healthcare is going to become 20% of the GDP by 2012. Well, thanks to the economic meltdown that we have had, healthcare is over 20% of GDP today, not because healthcare costs have gone up that much more, the economy has shrunk. So we've reached that. But no society wants to spend 20 cents out of every dollar on healthcare, really. That's, I personally don't. I would rather spend it on buying a car or a new shotgun or other things that I like to do in my free time, not to always spend it at the doctor's office. Next slide, please. This is how I think about it, though, especially when I ran for office. This is how I think you think about it. Look on your left, okay? And this is, some of this is my own data that I put together. In 1970, in orange, this is what a person making a minimum wage job, one of the people at Teresa's restaurant just down the hall here, would pay as part of their salary to buy health insurance. It was a small percentage, 5 to 20%, okay? But it was doable. In 2000, they were spending 100% of that minimum wage job, 40 hours a week. Everything they earned went into health care. By 2020, my prediction is that'll be 250%. So if you're not blessed with a good education and you don't have very good skills, so you're going to be stuck working in minimum wage jobs as an adult, you may have to have 2.5 of those full-time jobs to buy health insurance. And that's just too expensive. The market will not work like that. That'd be the equivalent of all of us having to pay $200,000 a year for a car. None of us would drive cars if we had to buy them at that price, so we might have one in our lifetime. So this is where health insurance is. As a percentage of median household income, this is taking all workers, so most of you in the room are probably middle to upper middle class workers. This is what you're spending on health cost. Okay, let's do the next slide. This is provided to me by Professor Reinhold, Uwe Reinhold from Princeton. Uwe is one of the conservative economists who I think should get a Nobel Prize for all the work he has done. He says that by 2016, we're going to be spending 45% of our wages buying health insurance. So we can't do that. I mean, healthcare is really important, but it's not worth half of all we earn, I don't think. We need to reform healthcare to get those costs down. Let's have the next slide. How do we spend the trillions of dollars on healthcare? Well, we spend a lot of it on prescriptions, physicians' costs, and hospital costs. So any politician, especially those in Washington where they don't let facts confuse the reality of the situation, okay, they're going to tell you they can save money by reducing administration, by taking it out of nursing homes, by improving public health, and by doing other things. Well, that just doesn't add up, right? I mean, you've got to cut hospitals, doctors, and prescriptions to really save big money in healthcare costs. So whatever happens in Washington will affect all of us because it will mean fewer dollars to spend seeing the doctor, covering what we're in the hospital, and taking care of our prescription needs, okay? So until we reform the system in a way that allows the market to leverage those, unilaterally reducing those out of Washington will have pretty profound impacts on what we get as consumers. Let's have the next slide. Okay, the uninsured. Well, they make a good case, and a lot of doctors support universal health insurance because they want everybody to have insurance. And politicians do too because it sounds good and it feels good. And of course, I think all of us are a little worried if we lose our jobs, will we lose our health insurance. Let's have the next slide. This is the number of uninsured in 2005 in the U.S. If you live on one of the southern states, the borders Mexico, you have really high uninsured rates. If you live in the upper Midwest, here in the Dakotas, you have very low rates. Minnesota has the lowest rate of uninsured, and that's because we have a state where lots of people are employed. Most people get health insurance through their employer. The number of uninsured in Minnesota tracks the number of people being laid off by medium and big-sized companies. And so what we have in Minnesota is a small, what we call a individual market, or a market, you know, if you're trying to buy insurance as an individual, not working for Mayo or IBM, but you're trying to buy it as a three-person operation or as a single person, that market's tough, it's expensive. And so what we have worked on in Minnesota is trying to reform that market to create a sort of a single-wide rating across the state to create more competition and allow more competitive products to be sold. But if you're a doctor practicing in the southeast or southwest, you may be more likely to favor universal coverage because that means your patients will start paying you. And if you run a hospital, you want everybody to have insurance because you don't want to have 1 in 4 patients not paying the bill. I had a patient come to the Mayo Clinic this weekend. I saw them Sunday and then talked with them again last night. And they were telling me that they had to take one of their children in Dallas to a hospital. And they went to the waiting room in the emergency room, totally full of people who did not speak English. And maybe they're here as legal residents, maybe they're Texas citizens, maybe they're illegal. They didn't know, but they were surprised. But the young girl got admitted to the hospital, and then they called the next morning to speak to her, and the operator at the hospital said, "I don't speak English." So these are frustrations, and this is what the number of uninsured is doing if you're on one of those border states. And that's why people are so frustrated about illegal immigration there, because it's affecting how they get health care, how they do work,